Good morning, and welcome to Thoughtful Thursday, brought to you by General Practice Solutions. This week's story is Primary Care's early winter vaccination effort. In the past few days, NHS England has confirmed that more than 10.4 million flu vaccinations have already been delivered for this year's winter programme, alongside nearly 3 million COVID vaccinations. These vaccinations have largely been administered through GP practices, primary care networks, community vaccination clinics, care home visits and community pharmacies, rather than hospitals. NHS England has formally acknowledged that this work is helping protect the most vulnerable patients ahead of winter and is reducing pressure on urgent and emergency care. Across England, practice teams have been running intensive vaccination activity throughout October. Clinical and administrative staff have been contacting high-risk patients, setting up weekend and evening clinics, attending care homes, and delivering opportunistic vaccinations during routine reviews. This has included older adults, patients with long-term conditions, and pregnant women. National reporting this week states that uptake in several of these high-priority groups is already ahead of where it was at the same point last season. The intention is clear. By vaccinating high-risk groups before flu and winter respiratory illness begin circulating widely, the system is aiming to prevent deterioration early, reduce avoidable admissions, and keep more patients safely at home over the coming months. Although vaccination is often presented as routine, the current delivery has taken place against a difficult operational backdrop. This year's program has involved late changes to eligibility criteria, altered sequencing for cohorts, and repeated updates to national messaging. Despite this, practices, primary care networks and community pharmacies have mobilized quickly and at scale. NHS England's latest primary care bulletin does not treat this work as automatic. It explicitly thanks frontline teams and acknowledges the strain that fast mobilization places on day-to-day capacity. That is a notable shift in tone. It frames primary care not as a pressure point, but as the mechanism through which the wider NHS maintains resilience going into winter. The impact of this work is immediate and measurable. High early vaccination uptake in older and clinically vulnerable patients is strongly associated with reduced severe illness from influenza, fewer out-of-hours respiratory crises, and lower unplanned hospital activity in frail and multimorbid groups. NHS England has been explicit that this programme is part of winter planning. The position is that prevention delivered in the community will translate into reduced demand in urgent care, ambulance activity, and acute respiratory beds in December and January. In simple terms, the work being done in GP surgeries and local vaccination clinics now is already helping stabilize the system before winter pressure peaks. For practices and PCNs, this is also an example of integrated working at neighborhood level. Many areas are no longer treating vaccination as a competition between general practice and community pharmacy. Instead, patients are being directed to whichever site can vaccinate them fastest and most safely. That model reflects what NHS England is now describing in policy language as neighbourhood care, care delivered locally, by teams who know the patient, in formats that are accessible without requiring hospital attendance. General Practice Solutions supports this model of primary care. GPS provides operational support that allows practices and networks to keep capacity focused on direct patient contact. That support includes administrative resilience, clinical coding and workflow management, telephony support to handle surges in demand, and scalable assistance with recall, population health activity and follow-up actions from national programs such as seasonal vaccination. By taking on the background work, GPS enables practices to keep clinicians with patients, maintain safe access and protect continuity during high-pressure periods such as winter vaccination season. That's it for this week's Thoughtful Thursday podcast, brought to you by General Practice Solutions. Thank you for listening. If your practice, PCN, or federation needs support with capacity, recall, workflow or winter demand, General Practice Solutions can help you protect clinical time and maintain safe access for patients. Join us next week for another Thoughtful Thursday.